Hello and welcome to Sunshine Plus, your ideal TV program sponsored by the Ondo State Government. I am Dakpo Aruwajoye. Health, they say, is wealth. So on this edition, we shall be focusing on a critical sector, the health sector, which any sensible and responsive government cannot afford to treat with levity. The Ondo State Government is pushing forward with its health reforms aimed at improving the primary health sector and as well as establishing more referral centers across the 3 senatorial districts. Also, the governor, Arakunrin Oluwarotimi Akeredolu SAN, is at the same time upgrading the Akure Specialist Hospital into a full-fledged teaching hospital to serve the academic needs of the Ondo State University of Medical Sciences in Ondo, as well as enhance public health service delivery. Our correspondent, Adiola Adeniyi, and the package you're about to see X-rays the health sector reforms of the Arakunrin Oluwarotimi Akeredolu administration. Enjoy.
The establishment of hospitals is usually taken with a pinch of salt by citizens because it sometimes operates without much attention by government, coupled with lack of medical facilities, inadequate bed spaces, lack of conducive environment, frequent strike action, inadequate medical personnel, among others. These and many more have been discovered to be the reason why Nigerians travel to India, China, United Kingdom, and other countries for medical treatment.
There's no amount that is too much for you to expend to make sure that you stay alive. So I think that's one of the reasons why people want to go to any extent to protect their life. But in case of Nigeria, I think dilapidated health facilities are one of those reasons why people tend to travel abroad. You know, now health is one of those institutions that have been computerized, and most of these equipment, they are not where to be found in our jurisdiction here. So people tend to go outside where this equipment abounds.
It's something that the country should really look into and try and see how to curb it to a very large extent, because aside from the fact that you're talking about service delivery, it's a significant economic loss to the country when resources that ordinarily should be used to develop facilities here are spent in other places developing such facilities. It also limits the expertise of the staff involved, because the more people clamor for more specialized care, it's more like propels local facilities to aspire to deliver such facility.
However, the governor of Ondo State, Arakunrin Oluwarotimi Akeredolu SAN, is determined to provide first-class health facilities for the people of the Sunshine State by taking another giant leap in the health sector of the state. It is the upgrade of the former State Specialist Hospital Akure to a teaching hospital complex and the commencement of modern world-class buildings in the hospital to complement the services of the state-owned University of Medical Science Teaching Hospital, Ondo Town.
University of Medical Sciences Teaching Hospital Complex at the Medical Village complex in Ondo. 3 locations, and that's why it's called the University of Medical Sciences Teaching Hospital Complex. We have in Akure, we have the Ondo complex, and this is the Medical Village. In the Medical Village here, we have all the specialty practices except pediatrics, which is in Ondo, and in Akure we have a replica of all that is here also in Akure. In addition to the primary purpose of the teaching hospital, which is to handle referral cases that cannot be handled by secondary and primary healthcare centers, complex primary cases. We also have general outpatient departments that sees to all commerce problem. So our own kind of teaching hospital, which is what is encouraged now, traverses all the sphere of primary healthcare, secondary healthcare, and tertiary healthcare. But in particular, there are areas that we have a specialist advantage. We do specialist care that are not common to all teaching hospitals. We do spine care. We have a specialist oncology setup, that's cancer setup. We also have specialist infertility setup. We also have specialist cardiac interventional setup. We're about starting our renal transplant program, and we are looking at other areas of high-end medical care delivery that we are looking at.
The former 150-bed specialist hospital is currently witnessing the construction of modern buildings with a target of making it a 500-bed hospital.
We have improved on our processes, and a lot of our support systems are functional. We have also experienced a high surge in people who will be skeptical about coming to receive treatment in the general hospitals than it was before now, such that we don't even have spaces for admission. We saw a lot of patients who could not be managed on bed, so which is not so good for any hospital. It's a laudable, and we must give thanks to the government for having a vision to expand and create this kind of environment.
Taking a tour around the facility, Arakunrin Oluwarotimi Akeredolu SAN expressed satisfaction at the pace of the ongoing project.
All of us have toured this facility. We have seen that since we came on board, including his road network of this hospital, it has changed, and a number of the buildings here, they have been renovated. The important thing is that we are building a new medical ward. So very soon, by next month or so, the frontage there will go down, and will now allow for a more modern medical ward facility to be there. Our medical university, the University of Medical Sciences in Ondo, needed to have a teaching hospital, a befitting one. And rather than us concentrating in one place, it was our choice that let us have a multi-sector, multi-campus, not a campus, a multi-complex teaching hospital. So we have one in Ondo, probably tour Ondo very soon, because the same building, the structure that we are going to put here in Akure, we have started in Ondo, and that one is moving up. And Akure is going to move up soon, very soon. Our target at the end of the day is to have a 500-bed hospital, and we think we are glad the governor was able to make out time today to come and see the different developmental projects in this hospital, and most especially the new hospital complex that is coming up. Before now, like the governor said, there were about 150 beds in this hospital, and by the time the new hospital complex is completed, we would have increased the holding capacity of the hospital.
Aside citizens that will benefit from the medical facility, staff of the hospital expressed pleasure at the facelifts in the premises.
Because of the new structures that are coming up, and the facelift that is being given to existing buildings. You see, you have a very good working environment and you feel happy to work in the teaching hospital. So exactly, we are motivated, we are good to be here, the new offices and everywhere, the paved walk and all of the environment is clean.
You need to see the look on the faces of our patients that were on the ward when we brought in our new set of hospital beds. And it's a very good thing that even some medical issues that you may want to take abroad could easily be solved here in Akure.
Since the instrument is being supplied to the department, we will be able to take the delivery very easily, no problem. You can look at it. It's very easy to adjust, unlike before. We are using the archaic one, but now the one we are using is very good. It's very good. It aids easy delivery.
With the massive renovation that we're witnessing now, it's a great development for us, and it's for every stakeholder, but importantly to the patients, because these are the end users, to the community generally, because we're going to have an hospital at the end of it all that will be world class, an hospital where service delivery will take place and go on in a very decent environment. That takes me to even the members of staff. They're going to be working in an environment that is conducive, the ambience is going to be fine and all of that. And so ultimately, everybody benefits, and it's going to help the medical and the paramedics. You do your work in an environment, you do your work with the right equipment, the right motivation, and then you can be sure that the outcome, at least at the end of the day, to the end users, will be fantastic.
In short, I was even surprised when I get here, the way they take care of people. We don't have, at least going to 3 weeks to 4 weeks here, there's no casualty. Even the way they will watch people here, that I would be afraid, and the way the doctors, with the nurse, take care of them, 100% satisfied. The equipment is fine, 100%. I appreciate them, 100%. It is a place that one can recommend. With what I see for the past 2 to 3 weeks.
This is the male medical ward, as you can see. We are renovating, currently renovating. We've done a bit of that, but we just completed the renovation. It's going to serve as the surgical patient and the general patient at the moment.
The University of Medical Science Teaching Hospital Ondo complex is not also left out in the medical spree of Arakunrin.
We've been able to achieve a lot. The Ondo complex was a special hospital before. We moved all the admissions into medical village here, and all clinics take place there. We just created the general patient department there, the medical outpatient specialist clinics, surgery outpatient specialist clinics, ENT, ophthalmology specialist clinics, all are just new creation there. We have a whole new pediatrics complex. A lot of things that I cannot start even mentioning.
Ayeton Titilope is a patient of the Orthospine Neuro-Female Ward in the Unimed Teaching Hospital who benefited from the equipment in the hospital.
I came here January 27 precisely. 7 months pregnant with multiple fracture. Fracture here at the thigh. Fracture here with a lot of exposed wound, bone exposed, even lost bone. So it was as if there was no hope. People that rushed me down, they were like, the woman has given up. But I thank God I'm still alive. They have really tried. God has assisted them. The doctors, the nurses, they have worked. You know, when somebody comes with pregnancy, and they have to take the person to the theater to operate on the leg. You know, it's a serious work. They did it to the extent that the fetus was not affected, even despite I was giving anesthesia. Thank God for the good equipment the government have provided. We really appreciate our government. We pray God will continue to help you.
Speaking on the provision of healthcare equipment to facilitate healthcare delivery in the wards, the Chief Medical Director of the hospital noted that it is, indeed, a great feat achieved by the governor.
Not only that people get access to the right care, the right type of care that is required for their condition. Hardly do you get people taking patients who are ill as a result of lack of manpower or facilities to care for complications out of Ondo State. In the past, almost all complicated illness were referred out of the state to the neighboring teaching hospitals. That has ceased. I would say kudos to the Akure administration. The fact that the government is committing to making choices that is helping the delivery of healthcare in the states is very laudable.
Far beyond the aesthetic value that will be added to the complex, it is more interesting when the multiplier effect of the presence of the teaching hospital in the environment is considered.
The advantage in that is that because whether you like it or not, people will fall sick. And some of this sickness can be very serious at times. So the amount of people who have to travel out of the states to seek healthcare far away from the comfort of their location has drastically reduced. The statistics of people who will not even be able to access care as a result of non-availability of those care, and as such will suffer the consequences of death and complication has reduced. We offer specialist care now that are not common. That means that people are coming from outside, top medical tourism, people are coming from outside the state to come and seek healthcare here. They come with their relatives who, apart from boosting the IGR of the state, they come with their relatives who will stay in hotels, who will buy things, who will eat. It's also boosting the commerce of the state. The facilities are expanding, the government is employing more people to work. As the buildings are going on, a lot of value chain is being created. Workers to supply the blocks, to bring the cement, the bricklayers. It's a whole lot of, it's a win-win situation for the, and we've not even gotten there. A time will come that as we're at the rate at which we are going, Ondo State will become the hub, not just for Nigerians, for West Africa and Africa as a whole, where people will be coming to, just like people go to India to go and seek healthcare, people will now start coming to Ondo State to seek healthcare. That's the direction in which we are moving to.
With the consciousness that medical personnel is crucial in providing qualitative healthcare to the people of the state, the Akeredolu-led administration has recruited medical personnel to various health institutions across the state.
Over the last 1 year, the government has employed over 60 new specialists, over 150 specialist registrars, doctors and medical officers, and over 200 nurses, in addition to medical laboratory staffs, medical health records, pharmacists. We employed over 30 pharmacists and admin. So we are looking at the number of additional 500 new personnel coming into the teaching hospital services.
Today in the hospital we have all the specialists. Almost all the departments have several specialists. If I take
the O&G department, for example, we're talking about a complement of about 12 or 13 obstetrician gynecologists. We in internal medicine we have specialists across all the different subspecialties, cardiologists, neurologists. Even with time, those who even need to go to other places outside of Ondo State will not need to do that because we have all those specialists around. And so government is trying to create infrastructure so that these specialists will stay around, they are motivated, they come to work with us so that we don't have brain drain, moving to other places.
As part of the health revolution in the Sunshine State, the governor has upgraded health facilities in the state to provide quality services for children below 5 and pregnant women, while the Mother and Child Hospital had been extended to other senatorial districts in the state.
We have 5 now. Now you see, what we have done is that we have decided not to name them Mother and Child, but mother or mothers and children will be taken care of in that hospital.
It is also on record that Arakunrin Akeredolu SAN has distributed $5 million biomedical equipment to health facilities in the state. The equipments were the ones secured by the governor during his visit to the United States of America from MedShare, a US-based non-profit organization in Atlanta, to strengthen the state's health sector.
We knew that you had some shortfalls in medical equipments, facilities in the state, and there was need for us to bridge it. And the only way, one of the ways, and we felt that this was so apt, was to get to a facility like MedShare, who all over the world, and I know they are doing this for National Hospital, they have done it for Lagos, and it's just because we didn't take advantage of it on time. So we decided to take advantage of this, and we had to pay for logistics for shipping 22 40-foot containers for us, and that I think it cost us about over 200 million naira, which we paid to them. And what we are having at the end of the day, we worth over about $5 million.
In the last 2 or 3 months, we have taken delivery of about 20 containers, 40-feet containers of medical equipment, which we have distributed all across the state, and consumables, and we are still distributing. In fact, the Central Medical Store that has been abandoned for so many years has suddenly come to life, and we now have equipment store. We have a lot in store that we have not even given out, that we'll give out over a period of time.
Some of the equipment that we have not distributed on the wards. Okay, some of them are consumables that it can be used on the wards, in theater and some other places. You can see these are walking aids for physiotherapy, for orthopedics, and then you still see a resuscitator there.
The government is stopping at nothing to bracket its people in the envelope of good health, and that is why it is introducing the contributory health insurance scheme.
Of course, very soon, maybe within the next 1 or 2 months, the health insurance scheme will start fully. The contributory health scheme will start in the state. We already have a law, and we don't only have a law, we have an office for the contributory health scheme. We've employed a general manager for the scheme. We've deployed staff to the agency, and the agency has been doing a lot of consultation, meeting with the various interest groups, and I think we're at the peak now, and we're going to launch out any moment from now.
So far, so good. It has been observed in the Sunshine State that the Akeredolu-led administration has brought about a paradigm shift from the old order, giving rise to indelible intervention not only in infrastructural development but also in the health sector. Adeola Adeniyi for Sunshine Plus.
Welcome back. By now, you must agree with me that Arakunrin is really touching the lives of the people of the Sunshine State in numerous areas, and most especially the health sector. Well, that's all we can take on this edition of Sunshine Plus. I am Dakpo Oluwarotimi. Thanks for being a part of it, and God bless the Sunshine State.